We can all have estimates of the future. The reality is, in 2014 alone, just to reiterate, for prescription drug prices, all prescription drug prices, not just specialty drugs, but all prescription drug prices increased by 12.2%. It was 8% last year, but that, of course, in both years is the fastest rate of growth for any part of the healthcare system. When you look at Medicare, the Medicare actuaries, Medicare officials see prescription drug prices as the fastest growing part of the healthcare system.
What Neera quoted was actually not price growth, that was spending growth. And spending growth is the combination of price times volume. So she's right that in 2014 we did see spending growth increase. And a large part of the reason that we had that, again, was new treatments for hepatitis C that are curing a disease that kills 5 times as many people as HIV/AIDS, that was going to cost our healthcare system $80 billion over the next 20 years' time. If you look back at the entire last decade in terms of spending growth for prescription medicines, we were less in terms of spending growth compared to hospitals, compared to doctors, compared to home health care. If you look going forward over the next decade, we're expected to spend $2.4 trillion more on healthcare in this country. 85% of that additional $2.4 trillion is attributable to hospitals, doctors, home health, nursing homes, everyone but prescription drugs. We're about 15% of that increase going forward.
Let's let
it's always everyone else. Let's get clear on 2 important points. One of the reasons patients are non-compliant with their medications, a very large reason they're non-compliant with their medications, is prices, because prices are very high. Just take the diabetic example that was given before. Insulin in the United States, non-discounted price, $372 for a month of treatment in the United States compared to $46 in France. Januvia, another drug for diabetes, $330 in the United States compared to $35 in France. That's a major reason for non-compliance. The second point I want to address is they're saying, look, all we need is competition. But the fact is, you get a lot of competition in the drug market, and it doesn't necessarily drive down prices because, as I mentioned before, doctors don't know prices.